Let's continue our discussion on Foot Yang Ming, the stomach meridian. Now stomach 2 or the four whites. Stomach 2 is located 3 chun below stomach 1 in the depression of the infraorbital foramen. Stomach 2 or four whites, grain gate or four brightness as it's called, is a point of the yang chow mai. Four whites refers to the four white areas of the eye, above, below, and to either side, and is used for a similar range of symptoms as stomach 1, where there is inflammation, pain, allergic rhinitis, facial paralysis, or tic, internal and external wind invasion. It is considered less effective than stomach 1, although there is less risk of bruising. Local point for trigeminal neuralgia, facial paralysis, allergic facial swelling, sinusitis, and sinus headache, hyperthyroidism with protruding eyes. So as seen here in the picture, although not major point, Sibai stomach 2 may be used in the following three clinical situations as a substitute for Chengchi or stomach 1 in the treatment of eye diseases for those who have not mastered the more difficult technique of needling the latter point as a local point, often joined to the adjacent points for facial pain and paralysis. And 3, in the treatment of roundworms in the bile duct. Indications: eye disorders, nasal disorders, rhinitis, sinus. The combination would be superficial visual obstruction would be stomach 2, bladder 1, and LI4. For headaches and visual dizziness, stomach 2, kidney 1, and bladder 11. Consider the orbital neuralgia feeling of smoke in the eyes, poor distant vision, trigeminal neuralgia, sinusitis, rhinitis, or facial paralysis. Its alternative name of grain gate refers to the mouth, which is the gate of the stomach. Location. With the eyes looking straight ahead, directly below the center of the pupil, in the depression of the infraorbital foramen. How to find this? With the patient looking straight ahead, the first 4 points of the stomach channel are located on a vertical line drawn through the center of the pupil. Within the area of the lower eyelid, the infraorbital ridge presents itself as a distant bony structure. Starting at the infraorbital ridge, palpate inferiorly until you can feel the depression of the infraorbital foramen. This is often located slightly medial to the pupil line, where stomach 2 is located. Needling 0.3 to 0.5 chun vertically or transversely, subcutaneously, towards SI18 or LI20. For example, in the case of facial paralysis, deep needling in an oblique cranial direction is contraindicated. Caution: infraorbital nerve eye injury. According to some classic texts, moxibustion is contraindicated. Actions and indications: benefits the eye, clears heat, eliminates wind. Special features: important local point for disorders of the eye, pain and paralysis of the face, meeting point with a yang chow mai according to some authors, a less risky substitute for stomach 1. Thank you for your attention.